first step is to collect the correct equipment that will be needed for the procedure. This includes a trolley and/or blue tray, blood culture bottles, a green-topped aerobic bottle and a purple-topped anaerobic bottle, a blood collection set, a tourniquet, a sterile drape, 2% chlorhexidine in 70% alcohol wipes, 2 to decontaminate the tops of the blood culture bottles and 1 to decontaminate the patient's skin, sterile gauze, a waste bag, tape, a specimen bag, CRS request labels, alcohol rub, a sharps container and gloves and apron. Preparation of equipment. Clean your hands using the 7 steps. Prepare your aseptic field using an alcohol wipe. You may have to clean first with a detergent wipe if visibly soiled. Decontaminate your hands as before. Gather your equipment and go to the patient. Patient preparation. Explain the procedure to the patient and gain verbal consent. Check they have no allergies. Confirm identity.
Source of infection in your blood, okay? Now, is it okay if I take some blood from you?
Yes.
Okay. I'm going to need to check your wristband with your name and make sure that you're the right patient I did the labels for, okay? So, can you confirm your name?
Jane Smith, 2nd of the 3rd, 1962.
Any allergies?
No.
And is it okay that I take blood from you?
Yes.
Now prepare your trolley. Decontaminate your hands. Arrange the items in the blue tray, ensuring all key parts are protected and expiry dates are checked. Check the expiry dates on the blood culture bottles. Also check that the bottles are in good condition and there is no discoloration of the discs on the bottom. Do not use any culture bottles showing evidence of contamination. Ensure patient comfort. Place the sterile drape under the patient's arm. Apply the tourniquet and identify a vein.
Is it okay if I try the other arm, see if you have better veins?
That's fine.
Lift up your arm, please. Fist.
Next, remove dust caps from blood culture bottles. Decontaminate the exposed tops with 2% chlorhexidine wipes. Allow to dry for 30 seconds. This is an important step to prevent contamination of the sample. Release the tourniquet. Disinfect the proposed puncture site with 2% chlorhexidine using a hash formation. Allow to dry for 30 seconds. Decontaminate hands by using alcoholic hand rub. Put on a pair of non-sterile gloves. Reapply the tourniquet. Insert the butterfly needle. Upon flashback, firmly push the vacutainer unit down to cover the puncture, the septum of the aerobic bottle first. This is important as you do not want to introduce air from the tubing into the anaerobic bottle. The bottle should be held upright. Collect 10 ml of blood. Disconnect and do the same with the anaerobic bottle. When all the samples are collected, cover the insertion site lightly with a piece of gauze, withdraw the needle and activate the safety device. Dispose of the needle safely in the sharps container.
Push that now.
Put the CRS request label on the bottles before leaving the patient's bedside. Ensure that the peelable barcodes are left on and are not covered by the request labels, as these are needed in the lab. Place in the specimen bag and arrange for transport to the lab. Remove your gloves and apron. Decontaminate your hands. Dispose of your equipment correctly, and then clean your trolley and tray.